Good morning, everyone. Welcome to the Mental Health Services Oversight and Accountability Commission meeting. My name is Mara Madrigal Weiss, and I am the chair of the commission. I want to thank you for attending today's special meeting. Before we begin, let us take a moment to honor the memory of those we lost on 9/11. We remember the brave first responders, firefighters, law enforcement officers, and paramedics who ran toward danger, risking and ultimately giving their lives to save others. We also pay tribute to the innocent lives lost in the World Trade Center and on the planes whose stories and sacrifices are forever etched in our hearts. As we observe this National Day of Remembrance, let us reflect on the courage and the resilience and renew our commitment to supporting one another. Let us take a moment. Thank you. At this time, we would like to note for the record that we are currently required to have a minimum of 8 commissioners in person to establish quorum. We have 1 vacancy on the commission and 1 commissioner currently on leave. Therefore, under the Bagley-Keene Open Meetings Act, 8 commissioners in person are needed to conduct business today. Also, under a change to the Bagley-Keene Open Meetings Act, any commissioners who are participating remotely will be asked during roll call to disclose if they have any adults over the age of 18 in the room with them during the meeting and the nature of their relationship with these individuals. Commissioners, please unmute your lines now for a roll call if you are participating remotely. I will ask you if there is anyone over 18 years of age in the room with you per Bagley-Keene. Additionally, you must remain on camera if participating remotely. If you need to step away or go off the camera, please let us know. And actually, Chief Counsel will be asking you that question. At this time, I'm going to pass it over to Chief Counsel Sandra Gallardo to take roll.
Good morning, Commissioners. Bontrager.
Here.
Brown.
Here.
Bunch. Carrillo. Carnevale.
Here, remotely. Nobody in my car.
Thank you. Chambers.
Present.
Cortese. Gordon. Mitchell. Robinson.
Present.
Roulette.
Here.
Vice Chair Alvarez.
Here.
Chair Madrigal Weiss.
Here.
Chair, we have quorum.
Thank you. It is now time for Agenda Item 2, General Public Comment. This time is reserved for comments on items that are not on the agenda. If anyone is interested in making public comment on items not on the agenda, please make those during this general public comment time. If you have any technical questions, please contact Commission staff at 916-500-0577. At this time, I will ask Amariani to go over public comment procedures.
Sorry, just 1 second. I'm having an IT difficulty.
Asked to be recognized.
Thank you, Commissioner Mitchell. Chief Counsel, could you please recognize Commissioner Mitchell has participated?
Thank you.
All members of the public will have the opportunity to offer comment as described in the agenda. If you would like to comment on an agenda item, please wait until that item starts. You may request to make public comment by clicking the raise hand icon on your computer or the app, or if calling in by phone, push *9. You will be placed in a queue to comment on that agenda item. When it is your turn to comment, the moderator will unmute your line and announce your name or the last 3 digits of your telephone number. When you are unmuted, we are able to hear you. We will do our best to take comments in the order they are received. Please note, once the public comment period for the agenda item starts, we will close the public comment queue, so please make requests to comment now. The moderator will insert the word "last comment" next to the commenter's name or number to identify the last public comment. Members of the public should be prepared to complete their comments within 3 minutes or less, depending on time constraints. When we have reached the end of your time, our staff will let you know, but we will let you finish your thoughts. We don't mean to cut you off, but we do want to help everyone keep time. We truly appreciate your understanding with this process. Lastly, if there are any members of the public using translation technology, please notify the chair, and at least twice the amount of time will be given to you during the public comment period. A live meeting transcription is available for anyone participating in the meeting. If that option is not currently visible, please activate the closed captioning feature located in the control bar at the top or bottom of your screen.
Thank you, Amariani. Would you please open the line for general public comment?
We do not have any public comment.
We don't have any online nor in the room. Thank you. Then we are going to go on and move on to agenda item 3, the Bagley-Keene special meeting requirement. In accordance with Government Code 11125.4C, I have called the special meeting to address a personnel matter that has come to our attention. Waiting for the 10-day public notice as required by Government Code Section 11125 would cause a substantial harm to public interest. We need a 2/3 commission vote to move forward with this meeting. That is 10 commissioners, or a unanimous vote of those present if we do not have the 10 commissioners present. I want to be clear that this vote is simply to move forward the discussion in closed session. According to the rules, this vote must happen before we can move forward with the closed session discussion. During closed session, we will discuss the matter in greater detail. At this time, I would like to invite commissioners to offer comments or ask questions about the process or Bagley-Keene rules, not the specifics of the personnel matter to be discussed again in closed session. Are there any commissioner questions or comments at this time? Please, Commissioner
So
Chambers.
just for clarity, we would need everyone in the room to unanimously vote to take it into closed session.
To proceed with the meeting in closed session, yes.
Okay.
And I just want to clarify, because we've met the 2/3, and I think we have 11 present at this point with the addition of Commissioner, that we would need 10 of you, because that's officially 2/3 of your membership. So 10 or 11 gets us into closed session. 2/3 or it's unanimous only if we didn't have the 2/3 present. Yeah, so that option's out. It's 2/3, which is 10 folks to vote in favor. Yeah.
Any other questions or comments? Okay, seeing none. And we had no, yes, please.
No, everything that happens in closed session is closed to the public. So we will have deliberations. If you take any formal action, which means you vote, then we will resume at the end of the meeting and announce any public action that has been taken. But the discussions will remain completely private. And there's a separate Zoom meeting, everything to move forward in that.
Okay. So are there any public comments regarding this discussion here? Amariani, please open the lines for this.
I see no public comments virtually or in the room.
Thank you. Then I would entertain the motion pursuant to Government Code 11125.4 that the commission move forward with the special meeting to address the personnel matter in closed session. Can I have a motion and a second
I motion.
that we move forward? Thank you. And a second to the motion. Thank you, Commissioner Robinson. We have a first and a second. I would ask now that you please take roll.
Bontrager.
Aye.
Brown. Bunch. Carnevale.
Aye.
Carrillo. Chambers.
Present.
Cortese.
Oh, aye.
Cortese. Gordon.
Aye.
Mitchell. Robinson.
Aye.
Roulette.
Aye.
Vice Chair Alvarez.
Aye.
Chair Madrigal Weiss.
Aye.
We've met the two-thirds.
Thank you. We are moving on to closed session at this time. Welcome back, everyone. We are now moving to Agenda Item 5, the report back from closed session. During closed session, the commission moved to put the executive director on paid administrative leave. We will continue the closed meeting we will continue closed session meeting at our next full commission meeting on September 26th. This concludes today's meeting. Thank you all for your participation and engagement in today's meeting. We wish you a good day. Take care.